On this episode with All the Things with Ashley, we have Mr. Kingsley Bryce of Affordable Medical Supplies. He is going to talk about medical supplies, obviously, with us,
Mhm,
and those of us who are in the long-term care industry,
mhm,
how we could use his services. And then he'll
mhm.
also talk about the industry as a whole. Okay. All right.
Yes.
So, Bryce, please introduce yourself and your company.
Yes, my name is Kingsley. I'm with Affordable Medical Supplies. Thank you so much, Ashley, for having me on. So just tell you a little bit about myself. We are actually a family-owned DME company. We've been open for 21 years. It's definitely hard to keep a business open like that. So for all you guys who are trying to start one, keep the faith going. But yeah, so we're family-owned. So my dad started the company. Like I said, 21 years ago. I came in and took it over about 6 years. So I've been running it. He's kind of slowed down a little bit, retired. But what we do here, we do help people get medical equipment, such things as hospital beds, rollators, walkers, wheelchairs, commodes, all of that stuff. Two different ways. So we have a brick and mortar store here in Plano. You can walk in and buy things. We also do rent things as well. So if you want to short-term rentals like a knee replacement, hip replacement, just need like a knee scooter, we have those wheelchairs. You can rent those. But then we also do process some items with insurance. So for example, Molina Medicaid, some items that they allow patients to get for sure long term. And then they have codes that we have to bill through for them to get covered, all that stuff. We do work with them on that as well. So a lot of our company goes into explaining how insurance works to patients if they choose to go that route. And if they don't, what options are available to them to utilize out of pocket. So and we've been pretty well rehearsed in it. Things as far as, enteral feeding, Dexcom sensors, yeah, to lift chair recliners, all of that stuff we kind of do a little bit about. So we're definitely ready and help anyone who needs it. We like to consider myself as a resource to anybody who has questions. So if you're renting a facility, especially assisted living facility, you just have questions, definitely feel free to always ask us. We'd be glad to help.
Okay. I think that
Mhm.
that was going to be one of my next questions is how you work directly with assisted living facilities or even waiver program providers like
Yeah.
uh, HCS or any other programs. Typically, how does that relationship look between you and those type of providers?
Yes. So I actually do work with assisted living facility, a couple of them. One of them that I work with right now has been Silverleaf. So um, it can be tricky because sometimes what happens for patients when it comes to insurance and out of pocket, where they get caught in between is the need for it. Sometimes they need an item within 24 to 48 hours. And I always tell everybody when you're going through insurance, insurance takes time. So don't expect it to come like a prescription for your medicine. You walk in and pick it up and go. On our end for DME, they do require us to have notes from the doctor, clinical notes. We have to have a history of the diagnosis, as well as we have to bill for it, make sure that's approved for. That process takes anywhere from sometimes as little as 10 days to sometimes a month to 3 months, depending on the item. So it is a process that takes time. With a lot of these assisted living facilities, people are wanting to take their parents or their loved ones into a home pretty quickly, and so we do short-term rentals for them to get them in the home while they get things settled and so they can figure out what their next step wants to be. Sometimes they decline quicker than they expect, right? So sometimes rentals are advantageous to that point where you have an item and, God forbid, someone your loved one passes away, you don't have to keep worry about, okay, well, I got to sell this item and find a place to go put it. And so for facilities like that, we are very helpful where they just need a short-term solution or the patient may have questions and they need something to be done. But if they do have insurance for some of their residents, so some of them are private pay and then they want to use their insurance to cover certain items, something we can work with as well, just to walk them through those options, help them better understand what's covered if they have the right diagnosis for those items, because insurance is very detailed with if you qualify or not for some items. So we do help them with that. And then you have different plan types, right? There's so much in insurance, depending on which insurance you have, Blue Cross Blue Shield, then you have PPO, and you have HMO, then you have Advantage plans, and you have, so there's a lot of layers to that insurance side that we try to help residents understand, like, hey, this is what your insurance covers for, here's what's not covered for. Here what your options are, right? Doesn't mean that you have to be left out in the street, but you do have some other avenue you can consider to still get the same level of care. So you talked about long-term plan types. So one of the ones that we typically deal with on the Molina side, they have a long-term care plans, and they actually have for people who enroll in that system, they do have contracted rates for their stuff. So you need to ask if you have a provider or a representative to ask them specifically, hey, what is covered under my long-term care? Not everything is, but there are some things that are. So with people who have those, like I said, we're a resource. So just call us. We have our own representative. They can also navigate through the patient's contract to help them understand, hey, here's what's afforded to you with this plan type. So yeah,
Okay.
hopefully that answers your question.
No, it does. 'Cause the
Yeah.
next question that I was going to ask is what affects the supply chain and inventory management? Like, what are those challenges? But you actually answered that for me.
Hmm. Hmm.
Dealing with insurance and the process in which you have to go through in order to
Yes.
approve some of these items.
Yes.
So, would you say that those were probably your primary, why can't I talk? Primary issues with supply chain and inventory management?
So, it's funny because supply chain was really messed up right around COVID. That's when things went, kind of crazy for. So for us in our company, we found more maybe success through the rental side. We didn't really have to go and chase down inventory as the economy is changing almost really every quarter. For us, it was a lot easier to kind of reduce some of the SKUs, the things that we worked with. We used to do everything. And we realized, that was probably not the best route because not everything, you can't be successful at everything. You can be successful at a few things. And so we chose to select ourselves on a few things that we could say, okay, we know we're not going to do everything, but we're going to do these few things really great. So we reduced our SKUs to certain insurance stuff, just your common things, right? So your wheelchairs, your walkers, some hospital beds for insurances, and just the things that people need on the regular everyday basis. So that helped us out quite a bit. And then we also saw that rentals were really helpful. We had a lot of loved ones who would get items for or a lot of parents and kids who would get stuff for their parents, and they ended up passing away either pretty quickly, and they didn't know what to do. Hey, do you buy this back, or where do I go to move this item? Or I have all of this stuff that reminds me of the loved one who passed away. What do I do with it? And so
Mhm.
our rental system actually was really effective to that because then we would come and pick it up, and they wouldn't have to worry about the extra stress to what do I do with this concentrator or this bed? And so we found that to be really helpful. And then for us, as far as inventory goes, it kind of shielded us from worrying about getting things in because we already have built up our inventory. So for rentals, it's like most of our items are always pretty much available, which has been really great. So if you're needing it, say 24 hours, or I need it today, it's a possibility, right? So that's been really helpful for not only for us, but also for patients and their families and stuff. So.
Okay, cool.
Mhm.
I have a two-part question about the type of medical products that you have. Um,
Sure.
the first is, could you give us maybe a high level category or categories of the type of medical supplies or products you offer? And
Mm.
then of those supplies, what is the most or some of the most innovative products or services that you offer?
Sure. Okay. So, high level, I'll probably just do categories because under those categories, there's sub levels to quality, right? So, hospital beds, again, there's so many levels of quality that you can have under that. Hospital beds is just a good generic one. For most people who don't know, there are semi-electric hospital beds, which is what insurance covers, and then they have full electric, which is what they don't cover, and everything else. So, semi-electric is the one that the head and the foot raised by the remote. But the height of the bed, you have to use a crank to go up and down. Nobody really wants to do that. But again, with what insurance covers, that's what most of them cover. The electric one does everything by the remote. Can go up, can go down, your head raises, your foot raises. Um, and then you have walkers, right? So you have just your two-wheel walkers. You have no-wheeled walkers. You have some that are hemi walkers. And you have rollators, which is a version of walker that you see with four wheels. So there's all those walker categories. And there's canes. So you can have your single tip cane, quad cane, bariatric cane, all of those things. Um, there's lift chairs, right? So lift chairs are different than recliners. Recliners obviously help you recline. Lift chairs help you recline and to stand up. So if you have difficulty getting up from a seating position, those actually elevate you a little bit higher to where you can reduce the strain it takes to get up every day. So it's definitely helpful for people who are older, have knee troubles, hip troubles. Those are really helpful. We also have a bunch of like bathroom items. So typically people, there's a lot of falls that happen in the bathroom. So you need like grab bars, you needing like toilet safety rails to help them to get up from the toilet. You have like a toilet seat riser, so it adds like 5 extra inches to your toilet seat. There's just a bunch of stuff in that bathroom department. There's also compression, right? So if you need, you have a lot of swelling or edema that builds in the morning or like swell, and you need to have some type of compression during the day to help that blood flow to get back up to your heart. That's what compression's for. Um, Cushions, bed wedges, we do those as well. So elevating your leg at night or even your head. So you have a certain type of back surgery, you need to be laid flat, elevated a little bit. You have wedges for those. Um, and then we have like stuff like quarter lifts. So for nurses in certain facilities, I think most assisted living facilities should always at least have one of those. Extremely helpful. And there are patients that can now no longer transfer themselves. A Hoyer lift is very helpful to honestly scoop them up, place them in a chair. You can take them, wheel them to the bathroom. So there's different types of versions of those. Usually nurses are pretty familiar with those when it comes to caregiving. So the list goes on. I can keep going if you really want me to, but those are the general basics.
Well, specifically, I also wanted to know, do you offer adaptive aids such as weighted spoons or bowls and cups for people who may
Yes.
have certain.
Yeah, only we can get access to those. We don't do a lot of those,
Mm,
but those are pretty easy access to get to, at least for us. A
mm,
lot of people, I know that. So something for DME that's been interesting, obviously, is like Amazon, right? It has been a competitor in the online space. And there's still a part of the generation that still likes to see and touch things before buying them.
mm,
But those items we've seen over the last couple of years have gone more towards the Amazon space where people want to purchase things, simply try them out and they can return them if they don't like them. So
gotcha.
we kind of go towards larger items now that people need more education on. They need trials, they need to touch and feel them. Ordering a wheelchair off Amazon or a walker or rollator, like we've done repair events at a lot of facilities and I've seen people put them together incorrectly. It causes a lot of falls. So that's where we still have our place to say, hey, like this is how you're supposed to set up. Here's the right height that you need to set it at. Here, the wheels don't go on the inside, they go on the outside. So stuff like that is where we kind of come in and teach them how to use the product correctly to prevent them from further falls or getting readmitted to the hospital. It's kind of where we kind of come in. So I think that was part one of your question. Part two was I think you
What's the
said
most
about like
innovative?
innovative. All right, so every year they have like a med trade show for us, and I've seen some pretty cool things. One of the ones that we just brought in right now is this hospital bed that is almost like a lift chair and a hospital bed in one, right? So you can go, it actually lays flat, and with the remote control, it'll rotate you and stand you up out of bed. So that's been
Really?
one of the coolest ones. Yeah, it's phenomenal. Like I've probably sold like 4 or 5 of those, and these are for people who are honestly almost on bed rest, and they need a lot of help, but their loved one is taking care of them, right? So they're not as strong and they may not be able to use a Hoyer lift. This bed does reduce a lot of that movement to get out of bed. It almost goes them from laying flat to standing up. So then you put a walker in front of them and they just do a little bit of a push off and they can go walk. So that one's for sure one of the most effective and efficient items that I've seen, innovative that I think has been working pretty well. Um, Outside of that, I feel like most items are pretty basic. Another one that's pretty cool that people don't really know about, it's a combo rollator transport chair, right?
Mhm.
So it is one that you can, if you want to walk, you can walk, but then if you get tired, you can go around to the front and sit down and somebody can push you. That's extremely helpful for long walks, like for assisted living facilities that are larger, that the residents want to get to lunch or to dinner and they get tired quickly. Those are really helpful to get them as far as they can go. And then if they get too tired, someone else can help them get the rest of the way. Those are pretty cool. But those are my top two, I think I'd say.
Okay, pretty cool.
Hmm.
You mentioned that you will do some type of education. So
Yes,
I'd like to know more about that from the provider perspective. Would you go into a
sure.
facility or in an agency and teach them how to use the Hoyer lift or how to
Yeah.
transfer?
Yeah. So this year was our first year. I had the idea of doing repair events for facilities. So we'll go out there and not only It's a free event for most facilities that we have, but we'll repair them on the events on the items they need because I've noticed a lot of people's equipment is actually neglected in these homes. They just don't know how to fix them. Most of the people who are on staff are repairmen, but they're not specific to medical equipment. They may
Right.
do things like beds or lights and stuff like that. So yeah, we've done that a lot this year, repair events, and that's been really helpful in actually educating these people on sometimes what they think they need versus what they actually need. So we have some people who will come in and they want a wheelchair, right? But when I tell them, I ask them, hey, can you lift 35 to 45 pounds? They're like, no. And I said, okay, are you going to wheel yourself around? No. Then why don't you get something like a transport chair? Much lighter that you can lift yourself, put in the car when you guys need to go out, push them around. So things like that, they just don't know the difference between. And that actually helps them out tremendously in their everyday life, the day-to-day living. So education on that, also education on how to use certain items. Simple one that I've seen a lot of people do with their rollators. They want to use their rollators to correct their posture, but that's not actually the point of it. The point of the rollator is actually just to be there for support. So one of the best ways I tell them is not to lean on it like a shopping cart. It's never really going to help you. It actually defeats the whole purpose of it. But you need to actually walk within that little square that it provides you. That's going to help your posture. And if you fall, you don't fall to the ground. You fall on top of, the rollator. You can catch yourself. So there's safety training that's small that most physical therapists will teach you how to do. But if you don't go to physical therapy, you're going to use it how you want to use it. So a lot of those small trainings help quite a bit. And then I usually talk to families about things that they may need to get in the future, right? As they digress or as they maybe see themselves further down the line, there are some items you should just skip over and get this item, now because it's actually going to take care of you for the next 5 years, as opposed to getting this item for a year and then the next 2 years you're going to need to get another one. So it's just there are certain things that obviously just because we've done it for so long, I've seen people with multiple sclerosis, I've seen people with Parkinson's that I say, hey, if they're going to be progressing at that rate in the next 2 to 3 years, consider this item because it's actually going to take care of them at that stage and this stage. So things like that, I found to be really, really helpful, especially for, just people, families who are new. They get a diagnosis they have no clue about. They're just learning about it on the fly. So, we try to be as helpful as we can just to let them know, hey, don't panic about this stuff. Here, there are some things and items that can help you guys out. And, that's what we're here for to give them resources. So, yeah, the repair events have been really successful, just as far as education goes and teaching and safety, right? Like that's the biggest thing. And also for you guys who are owners of these assisted living facilities, you're taking care of someone else's family member. So my idea is to take care of all of them, right? Their equipment and the patient as well. The equipment takes care of the patient. So if you take care of the equipment, you take care of them, right? That's kind of how I see it. So yeah, don't neglect those things that they use every day. It's like neglecting your car. The car needs maintenance. It's just as so as your rollator, your walker, wheelchair, all that needs maintenance. So yeah.
So do you know that you're helping them with compliance at that point?
Indirectly, yeah. I don't think that they think about it, but I am. I know that I'm taking care of the patient, but also, I mean, there's so much more. It's just preventing a lot of things from
Exactly.
happening.
But that
Preventative care is so important. So,
yeah, that's a part of compliance is
mhm.
doing those preventative measures. And by you doing those repair events, you're essentially also doing resident evaluation because you're looking at
Yeah,
the tools that they're using and saying, well, maybe we need to put a
right.
better alternative in place. And I love that because you're offering them valuable information without them
Hmm.
having to go through 17 doctors to try to figure out
Exactly.
what needs to happen.
Exactly.
Yeah.
Exactly. Yeah, they
Yeah.
might as well save time, right?
Yeah, yeah.
Yeah.
Okay. So we're getting close to the end of our interview.
Mhm.
What would you want to impart with long-term care providers such as assisted living facilities, HCS providers, even home health agencies? What would you want
Yeah.
to impart with them?
I think that I would like to let them know, probably that the medical equipment does more good than it does harm, right? So the knowledge about that stuff actually can, like, I think the knowledge that I have from just working in this industry is just something that people don't typically think about, right? And so ways to solve solutions, there's a lot more than they're aware of that are out there. I mean, I've had a lady who was taking care of her loved one for like the last, 4 or 5 years on their own. And simply by showing her like an item, I'm thinking about her future as well as the patient's. right? So that they would lift a wheelchair to bring it into their bag, and I always tell them, hey, look, you're taking care of them, but who's going to take care of you, right? If you get hurt. So let's look at another solution to get you taken care of as well as them. So I'm always thinking about the whole picture, and I think that for you know residents or for owners or for thinking about their patients, I think just use your resources. I'm definitely one, but just research and see what can we help to make this solution not only easier but safer for everyone, right? So that's just I have a nurse that works in my staff. I need to look out for them as well as the patient, right? What's a machine that I can get and have in stock that's going to help them and my facility in the long term, right? So your electric Hoyer lifts, if you get one of those, yes, it's expensive up front, but the warranty on those items is probably 5 to 7 years. So you think about that, that's actually a lot, that's saving you a lot more than having not having one or getting a used one that's cheaper because you're like, well, if anything goes wrong to this, I can just get my warranty to fix it and I'm taking care of my house and my all the residents for 5 years. Even better, right? So just thinking of those things in the longer term, or even like certain beds, or I've worked with some facilities who are wanting a certain look or a certain style for their assisted living facility. They want something that's a little bit nicer, and you want to attract a certain amount of clients to live in your home. There are medical equipment that reaches that standard as well. So there is a large range, and I just would say, hey, like use your resources, like see what's out there. If you have quite, there's so much stuff out there, but there are things that are better fit for you, and so that's where I want to come in and help as much as I can. Like I said, I'm a resource, so yeah,
Absolutely. Absolutely. Well,
yeah.
thank you so much for your time
You're
today,
welcome. Yeah,
Kingsley. Um,
absolutely.
I feel like you were answering some of my questions before I could get them out, which is great because that
Yeah,
means
yeah.
that you know about your industry and
Right.
you
Yeah.
know what you're talking about. And so I
Right.
appreciate that.
Of course. Of course. Thank you for having me on.
Absolutely.